Most people wouldn't sign a blank check and hand it to a stranger. Most companies wouldn't either. Except when it comes to healthcare. Sometimes they do. Let's start with the big picture. We all know that healthcare costs are high and rising fast. For the average US employee of a Fortune 500 company, the burden is already high. And it's even higher for the employer. In fact, healthcare costs are rising by 6% per year. That's almost 3 times the rate of inflation. Also, the cost for a procedure can vary wildly from hospital to hospital. For example, a hip replacement in Boston can cost anywhere from $18,000 to $74,000. That's a 313% difference. You wouldn't want to be the company throwing away $56,000 for a single procedure. But most large companies depend on third parties to administer their healthcare payment. This makes life easier for the company, but often leads to a lack of oversight and waste. As an example, when Henry's wife needed a hip replacement, her bill had 1 or 2 of the more common billing issues. All of this without the knowledge of Henry's company, since it's all administered by a third party. In fact, the federal government estimates an error rate of 12.7% on their healthcare claims. All these missed opportunities to save mean that each year you have less money to spend on other employee benefits, as employees pay more and more out of pocket. Luckily, there's FinHealth Navigator to address these problems. FinHealth Navigator is a powerful software platform. It has an extensive range of data, tools, and benchmarks that arm you with information to make better healthcare decisions. Like knowing when you're paying $56,000 too much for a surgery. Sign up for our next free webinar to see FinHealth Navigator in action.